All right. Thank you, everybody who has called in and joined us today. Very excited to provide some updates on how the Kentucky public health emergency unwinding is going as we are in the midst of it. We've seen a lot of successes. We've had quick responses to any potential issues and mitigated them. We're seeing great numbers and wanted to kind of share a progress update today, as well as a few things as reminders for what's coming and the timeline to expect. So with that, I can turn it over to Senior Deputy Commissioner Veronica Judy Cecil to walk us through information. And we will also take questions throughout. So feel free to chat in any questions you may have or requests for additional information, and we can get to that toward the end of the presentation today.
Thank you, Helen, and welcome everyone. As she mentioned, this is as going forward, starting this month, we're going to be having a monthly stakeholder just to provide updates. If you're interested in seeing the full stakeholder presentation that we've done last month, it is posted online on our Unwinding website. It has a lot more detailed information, and as Helen noted, today there's a couple of slides may have seen before if you participated in those, just because we want to reiterate that information. We think it's important information just to refresh memory. So I am going to share my screen, and we do turn off our videos when we're doing the presentation, but we'll come back on. Okay, just to reiterate, we have three primary goals for our unwinding and restart of renewals. One being the complying with CMS requirements. A state Medicaid agency has to be in compliance. If not, we're subject to penalty by CMS, Centers for Medicare and Medicaid Services, our regulatory authority. We may also lose our enhanced federal match, which is the largest portion of the cost is covered for our Medicaid expenditures is covered by the federal government. We could lose that enhanced FMAP that we have through the end of this year, as well as potential deferral of our federal match going forward. So it's important for a state Medicaid agency to stay in compliance. I'm happy to report that Kentucky was determined fully in compliant. We were not required to have a mitigation plan to address any shortcomings in those requirements. And we are one of 6 states that had that determination made. The other two are critically important goals, one being that we want to ensure anyone who is eligible for Medicaid, but for some reason did not take action, they may be what we call administratively terminated. Those are, as I mentioned, individuals that, if not for that technical reason as to why they didn't respond or verify or provide information, would have continued their coverage because they are eligible. These are individuals we want to make sure understand that action is necessary, and we'll be doing a lot of outreach to them. But we want to prevent those administrative terminations, and certainly we want to prevent a gap in coverage. And then, as we know, there are some folks that will no longer be eligible for Medicaid. Their income has increased during the 3 years of the public health emergency, or perhaps they lost coverage in a category. For example, we started covering women 12 months postpartum. That's a category of eligibility. If they are outside of that 12 months, then they are no longer eligible for Medicaid in that category. They could be eligible for in other categories or in other ways, and we do try to check that. But if they are no longer eligible, then we want to ensure that they understand there are options and for other healthcare coverage available to them. So we want to, during this time, make sure they seek out those options, understand those options. For example, perhaps they're qualified for a qualified health plan on the state-based exchange. And if that is the case, then we would want to ensure that they move over to the exchange and shop for a health plan that's right for them, to ensure no gap, again, in coverage from the end date of their Medicaid to the new coverage, either QHP or perhaps an employer plan. Those are our 3 goals. I've talked about this a lot, but just as a refresher, we took great effort to distribute our caseload across the 12 months of the unwinding period. And to do that, we aligned the renewal date of households to the same month. We aligned households with a SNAP case. Their Medicaid and SNAP cases renewal dates are aligned now, so that the Department for Community-Based Services caseworker and our sister agency DCBS is the agency that processes Medicaid eligibility determinations and renewals. We want to make sure they only have to touch that case once if they're SNAP and Medicaid. So we did align those renewals. We also took into consideration the fact that in December we have the fewest work days. So we have the lowest caseload in December. And we have fewer caseloads than in the beginning of the unwinding period, so May, June, July, than we do in the end of the unwinding period, the last 3 months of the unwinding period. We wanted to take advantage of having a lower caseload to make sure the system is processing cases correctly, identify any issues, monitor our workforce ability to handle the caseloads, and then be able to make necessary changes as we approach the end of the unwinding period and the higher caseload. So that was another reason why we distributed the caseloads a little differently. There are also 3 populations, just to remind folks. We are focusing on the Medicare eligible population. These are individuals age 65 and older who should have applied for Medicare because they're Medicare eligible. They may not have taken that action during the 3 years of the public health emergency because they had Medicaid coverage, but with that coming to an end, they need to take that action. During these 6 months, we will be providing a lot of outreach and support to these individuals to understand they need to file that application to Medicare. We are working with our Department for Aging and Independent Living, our sister agency that oversees the State Health Insurance Assistance Program, SHIP, SHIP. They have counselors ready, willing, and available to help those Medicare individuals understand what actions to take and support them through that application process. So again, during these 6 months of May through October, we're going to be tracking these individuals through the unwinding and their renewals and make sure that they take those actions. The good news is for these individuals, there is a special enrollment period. So normally, if somebody does not file for Medicaid when they become Medicare when they become eligible, there is a penalty during the unwindings. If somebody's renewal and they apply for Medicare and they're losing their Medicaid coverage, they get a 6-month special enrollment period. So they can enroll in Medicare anytime within that 6 months and not be penalized. We, of course, do not want to see these folks have a gap in coverage. So again, trying to work with them prior to their Medicaid end date so they file for that application and their coverage starts the first of the next month. The next priority population is in June, and these are individuals that include in March of 2020 had been determined ineligible, but due to the requirement for the continuous enrollment coverage, we kept them covered throughout the public health emergency. So every month, despite that determination of ineligibility, we've been keeping them covered from month to month. Their coverage will end at end of June. They'll receive a notice to let them know that they should reapply for Medicaid. So they'll need to file an application. to ensure that they are eligible for Medicaid in another category or based on income. So these folks, again, will have to take action to file that application. Perhaps they know they are still no longer eligible, and if so, we still want to reach them, make them aware of the Medicaid coverage ending, and help them understand what their other healthcare options are, including a qualified health plan on the state-based exchange Connect. And then the last priority population is what we call the QHP, or qualified health plan eligible population. Our system throughout the public health emergency has been going out and trying to verify individuals. And so it does allow us to see, get some insight into the population. And it does appear that there are people over the Medicaid federal poverty level. However, they are qualified for a qualified health plan and also to receive what's called advanced premium tax credit, APTC. What that does is help them receive assistance with that cost of a premium for a qualified health plan. In Medicaid, we have no premiums or cost sharing. On the exchange for a marketplace plan, a qualified health plan does have premiums and cost sharing. So this APTC helps folks with the cost of that. It can make a plan with no premium because of the APTC they receive. And so we, again, want to make sure that folks are shopping for those plans, understand the financial obligation with them, and what plan best fits them. We decided to push them to July. So between July and April of next year is when their caseload will be distributed, because we're making some changes to our system to provide some automatic support to them, to be able to connect them to an insurance agent so that that agent can help them shop for a plan. We're providing some other supports to this population. And again, we wanted to have all of those system changes in place before we started processing their cases. So as I mentioned, we have certain populations that we're prioritizing in April and May. That's the members 65 and older transferring to Medicare. Right now, we are following up on those with the May 31st, 2023 renewal by doing lots of outreach through various modes of communication. We've been sending them emails and text messages. They've received written notices, and so we're continuing to track those through the process to make sure that people are receiving the notices that they need. We were required to file on April 8th with CMS an unwinding baseline data report. It really just had a few metrics on it, but it's the baseline, what CMS wanted to see in terms of the number of beneficiaries enrolled, which, as you see, we reported 1,711,650. That was the snapshot that we took. At the time, we had pending applications received from the period of March 2020, the beginning of the public health emergency, to March 2023, which is the end of our baseline reporting period. We had 2,438 applications pending. And then the other metric that CMS is monitoring with all state Medicaid agencies is how many fair hearing cases are pending. Over 90 days. And as you note that we do have 575 cases pending over 90 days. We are taking a look at those, working closely with our sister agency that handles the hearings and making sure that individuals, keep in mind, we've been keeping them covered. So most of these individuals have not lost coverage due to the federal mandate, but we are checking to make sure those cases are still active and and working those cases so that people have their decisions. This is a snapshot of those May 31st, 2023 cases. One thing I didn't mention on the previous slide when we were talking about caseload is, just as a reminder, Kentucky, and every state's different, but Kentucky processes our renewals at the case level or head of household level. So, so anyone in that household generally will be eligible if that head of household and that household is eligible. So we take the 1.7 million folks and we distill them into cases. And the number of cases that we have for unwinding across the 12-month distribution period is 860,000 cases. So for a May 31st, 2023 renewal, we had 72,421 cases. Of that, 49,491 of those cases are passive cases. What that means is it's a case where we're going to go out, we're going to ping all the databases out there available to us, Federal Hub, we'll check income, we'll check assets. And so these are cases that qualify for a passive renewal. We also had 22,930 active cases. We call them active because their renewal and their eligibility is determined primarily including a resource or asset test. So it takes a little bit more information for us to make a determination. And that's information we can't easily gain by doing that automatic verification of all those databases. So they drop to what we call an active case, and they get sent a renewal packet pre-populated with the information we have on file or could verify, and prompts them to send us back information, including documentation if needed, for us to be able to make that determination. Of those almost 50,000 passive cases, we were able to passively renew 60% of them. I will say that that's a little lower than our normal passive rate, which is around 80%. But this is not unexpected, as we knew that with the public health emergency lasting 3 years, a lot of folks, we may not have update information on them, and may not be able to go out and verify the information automatically. So we do expect to have a little bit of a lower passive renewal rate based on that, and we're going to be monitoring that going forward. Of the active cases so far, as of April 12th, we've had 479 active renewals completed. So that means that those individuals with an active case have taken some type of action to submit information or to verify information that was included either on their renewal packet or a request for information that was generated because there's still additional information that we need. Of those 479 people, we have 347 that were determined eligible. We have 50 that transitioned to Qualified Health Plan APTC. What our system does, because we have an integrated system, eligibility and enrollment system, we will transfer cases if they're no longer Medicaid eligible, but our system can tell that they are likely eligible for one of those qualified health plans based on income. So our system will actually transfer those individuals automatically. So we had 50 of those go ahead and transfer over to the to the state-based exchange, Connect. And those individuals we will be assisting to shop for that plan so that their coverage will start on June 1 if their Medicaid coverage ends May 31st. And then based on the information provided to us or the verification, we did make a determination that 82 were ineligible. And our system and the information they provided us did not indicate that they were able to transition to a qualified health plan. However, we are still making sure individuals understand their coverage is ending and that they can find coverage, hopefully, in other ways. So as I mentioned, we're doing a lot of outreach to our members to understand that they have a renewal. Keep in mind that these individuals have not gone through a renewal over the past 3 years. If they came into Medicaid during the public health emergency, they've never had a renewal. So helping people, Medicaid members, understand what's happening. This is all new to a majority of our members. Is important. And so we're doing a lot of outreach, as I mentioned. When we dropped from doing that automatic verification and were able to passively renew folks, and then we had some of them drop to a request for information because we couldn't verify them, or they received that renewal packet, we took that list and we actually called individuals that were slated for some type of action, either the request for information or for the renewal packet. So we made 8,405 calls and were able to reach somebody. And then we had 8,003 calls where we left a message. Following that, we also, after receipt of information and the need to get some additional pieces of information, we made 4,382 what we call nudges to prompt the person to update the information. And then for the additional population that needs to take action, we left another nudge for 11,759. As this slide also notes, we mailed to 22,930 renewal notices. That's the active cases. We did send 19,713 requests for information to passively renew folks. These are the ones that we dropped down to an RFI because the information we weren't able to verify. And instead of discontinuing them, we wanted to give them the opportunity to verify or send back information so we could make a better redetermination. We sent out 42,267 email messages for what we call our 90-day alert. We have 1,498 email messages sent for a 60-day alert. What those two alerts are is we are notifying members approximately 90 days before their end date that their renewal is coming and what their renewal date is. We're sending another alert 60 days prior to their end date, along with or nearly simultaneous with the notice that gets generated and sent to them. For May, we did not update our system yet to send it to all members receiving a notice, but we will be doing that for months going forward. So anyone who gets a notice requiring action will receive a 60-day alert. Also, you might notice on the slide, we did have 63 cases that we received undeliverable mail. We are taking those into our mailroom. We have a process to update or search for an updated address and to resend those to individuals. We perform a communication to those, so we're going to try to call any case and send other modes of communication. If we have an email address on file, we will try to reach that in that case, anyone in the household, generally the head of household, to make them aware of the fact that their notice was returned to us. We will give individuals who haven't updated, we will give them the opportunity and additional time to submit that response. So we did 46,000 outreach calls already have been conducted, and over 6,000 calls have been received related to renewals. So this, again, is just a highlight of what the renewal process looks like. As I mentioned, members receive a communication about 90 days before their renewal end date. They'll receive another one about 60 days prior to their end date that's nearly simultaneous with their notice. And if individuals do not respond back by the 15th of their renewal date, they will receive an additional notice and outreach. I've gone over this slide in previous stakeholder meetings, but just so you know, the darker green are activities related to a May renewal. The light blue are activities related to a June renewal. The lighter green, or kind of looks like beige on my screen, are activities related to July, and that bottom right is dark blue is August renewals. Just want to reiterate for this slide is that there are two populations that have to take action. Those receiving the request for information and those receiving a renewal packet. And so those are the ones that we are focused on. We're going to be tracking through the renewal process to make sure they've responded. And if they haven't, trying to do outreach to them to contact them about the need to take action. It is very possible these folks are no longer eligible, and they may know that, but we want to at least have that conversation with them to ensure that if that is the case, that they have other coverage, or if they need any additional support to obtain that coverage. These are the notices that go out. Again, this has been in previous stakeholders forums. The far left is what the notice of eligibility looks like. If somebody's passively renewed, their notice of eligibility will tell them that that has happened. Their renewal date will go from, for example, May 31st, 2023 to May 31st, 2024. That's how you know that somebody's been passively renewed, is because, for example, for May, in early April, if we were able to passively renew them, their renewal date will automatically update in our system, and it will generate the notice that shows that their date has changed. The middle one is for what a request for information looks like. It's usually just a page or two and only requests the information we need to complete that redetermination. It could involve just a verification that could be handled over the phone, or if additional information is needed or documentation is needed, it explains how they're able to comply with that. And then the far one is the renewal packet, going to those folks generally that require us to get more information about their assets or resources. It's typically 3 to 4 pages long, pre-populated with the information we have on file already, and just gives them an opportunity to provide more, complete that redetermination. There are various ways that someone can respond to a notice. One is to complete and return the form. They can do that, they can mail that, or they can fax that. One is to go through the Connect portal, self-service portal. We understand that that is not an option for a lot of folks navigating an online database, but we are trying to encourage the use of Connect because it is going to be the fastest and easiest way for a redetermination to be processed. Individuals can take a picture on their phone and upload a document that way. They can scan and upload it to their Connect account on a computer. They can use that to change any contact information. The Connect account allows the the DCBS worker, the eligibility worker, to pull down the information, take a quick look at it, and make that determination. It's all easier if done within that Connect account. We're telling and asking, requesting members to check to make sure their Connect account is active if they already have one, or to create one if they don't. And now's the time to do it, not waiting for when your renewal date comes up, so that we can address any issues that might happen with creating that account. Understanding, though, that not everybody can access or create an account, you can still call the Connect hotline or the DCBS hotline for assistance, or you could visit a connector, an insurance agent, or a DCBS local office. The best way to find those are to go to our Connect website and look for find a connector or insurance agent, or find a local DCBS office links. So as I mentioned, we have encouraged members to create that Connect account. We are asking them to keep their contact information updated. If we can't contact, they have to take action, they may be administratively terminated, and we are trying to prevent that. So anytime that their contact changes within, just really at any time, if they have a new phone number available to them or an email address, we're encouraging them to add those to their account. They can do that various ways to get that information updated. So again, we are able to reach members through various modes of communication to make them aware of what's happening. And we want them to know to be on the lookout for those notices that require action so that they can respond. I've already mentioned several of these, but just to reiterate, there are people in the community to help individuals going through a renewal. Connectors are throughout the state. Licensed insurance agents are able to help. If you're age 65 and older and need help with that Medicare application, you can call the SHIP hotline or our sister agency, Dale. And then we're keeping all of our information updated on our Unwinding website. And if you haven't checked that out, I highly recommend it. We have a lot of information on it. We've been providing this for our providers. We just on April 7th updated Kentucky Health Net, which is the database that our providers go into to verify someone's eligibility. We now have the redetermination date on Kentucky Health Net. So when providers go in to check a member's eligibility, what we're asking providers to do is to take that opportunity to note the redetermination date and to share it with their patient so that they are aware of when their date is. This is particularly important for someone who may have an upcoming date within the next 30 days. It gives them the opportunity to then reach out to us through Connect to be able to find out, do they need to take action? What might have been sent out? Perhaps we have an old address, and give the opportunity to have that interaction with the member and make sure they take action. We've also been talking a lot at the stakeholder forums about the flexibilities that are changing as a result of the end of the public health emergency on May 11th. We have some that we are not allowed to extend and will absolutely be ending. A couple to note are the suspension of provider revalidations and the second presumptive eligibility period for members. During the public health emergency, we were allowed to have 2 presumptive eligibility periods per calendar year. That allowed individuals up to 4 months to file that full Medicaid application. On May 12th, we will no longer be able to extend a second presumptive eligibility for someone. There are flexibilities we were able to extend. One in particular is re-enrollment of a member to their MCO if within 120 days. We were also able to extend the appeal time for a member as well as the time in which the state has to make a decision. And then one particular flexibility we were able to permanently implement was around expanded telehealth. At the beginning of the public health emergency, we know that it was important to be able to reach individuals where they are as people were not going out and going to offices. And so as part of that, the Medicaid, along with a lot of licensing agencies, made changes so that ability to do a service through telehealth became much more accessible. We took the majority, if not all, of those flexibilities and have put them into a new regulation that we updated, 907 KR 3170. So for Medicaid, pretty much those flexibilities we put into place for the public health emergency for telehealth are now in our regulation. There are some things that are outside of our control, and that includes the use of a non-HIPAA compliant platform. For example, FaceTime. The good news is based on the Consolidated Appropriations Act in December, the use of the non-HIPAA compliant platform has been extended to December 31st, 2024. As that date approaches, if that changes in any way, we will notify providers. But until then, you can continue to use the platforms that you've been using that may not be HIPAA compliant. For a full list of all the flexibilities we implemented, the decisions the state made to either end, extend, or permanently implement that flexibility, there's a very comprehensive list out on our website. You can pull that down and it will help you understand what we put into place and what we have to unwind. I already mentioned a lot about the proactive approaches that we've taken to support members going through a renewal. We worked very closely and continue to work very closely with several community advocacy organizations, statewide organizations. They've helped us with our drafting our communications to be more simple and easier to understand, to lower the grade level of our notices so that they are easier to understand. We appreciate all their help. We're talking with them every day about what they're seeing out there or hearing. So they've been a great partner in supporting our members as we start the unwinding. Our managed care organizations will be also reaching out to their members and making sure that they understand what actions they need to take. So they will be proactively reaching out to anyone with an active renewal. They'll continue to focus them up until their end date. And then they can focus and they can outreach to them up to 90 days after their end date. The reason we did that is we want to make sure anyone who has lost coverage, if they were administratively terminated, If they provide that information within that 90 days, we will reinstate their coverage back to their end date for no gap in coverage. We also want to make sure these individuals, if they've lost Medicaid coverage and they're no longer eligible, that they move to other coverage such as the qualified health plan. I talked about the calls and nudges, and those are our contact center providing direct outreach to those individuals. They are also helping us track the fee-for-service population. Our connectors and insurance agents, I can't say enough about them, being out there throughout the state, providing support to our members going through a renewal. I talked about our tracking return mail. We made the Kentucky Health Net update, and we are also working on providers that utilize the Kentucky Level of Care or clock system to be able to pull a report of their members and their redetermination dates. Appreciate that our providers have been interested in finding out how to support our members and reaching out to us to find ways to do that. I've had a lot of provider associations request meetings for us to come present at conferences and meetings, and we're happy to do that. If you're a provider with a group that would benefit from a one-on-one meeting with us or a presentation, we're happy to do those. Just let us know. And then again, coordinating a lot with our sister agencies on providing support to the members going through renewal. This is the website I've been talking about, and if you haven't visited, I saw that Helen posted that in the chat. I definitely encourage you to take a look. It's very robust in information. We're posting all of our reports on it. I mentioned our flexibility spreadsheets on there. Our stakeholder sessions have been recorded and posted. Frequently asked questions have been posted and will be updated regularly. We have specific flyers and information, pamphlets and brochures on there, audience specific, so provider or member. If there's a gap that you see that you think would be helpful to support any efforts that you may be doing to support Medicaid members through renewal, reach out to us and we'll see what we can do to create that communication. We have tried to stay consistent in our message so as not to confuse members that are going through the renewal. So lots and lots of materials on our website. And again, I mean, the best way to stay in touch about what's happening is to check out that website. We are continually posting on our social media, Facebook, Twitter, and Instagram. If you could like us or follow us, we'd appreciate it. You don't have to do all three, but at least one of them so that you can stay updated on whatever's happening with renewals and unwinding. It is the easiest and quickest way for us to be able to put information out about what's happening to alert folks. For instance, we just were made aware of a scam where someone is using a 502-564, which is the state's phone number, and they're using that to call folks and try to offer them a health plan. It is a scam. So we're trying to combat those by being able to post things on our social media, make people aware of them and keep an eye out for it. And then any other information that might help you all stay informed or anyone stay informed about what's going on. And then, as we mentioned, this will be an ongoing monthly stakeholder meeting. We certainly hope you'll continue to come and ask questions on anything that you all might need more information on. We are trying to be transparent and available and approachable about unwinding and the restart of renewals because it will take all of us, we know, across the state to support our members through this process. And we just want to make sure people stay covered. So that is the presentation.